Hi everyone. Super excited today for a phenomenal day yet again organized by Business World. A big thank you to the organizing committee and for having me here and giving me the privilege and honor to be moderating a panel that is full of stalwarts from the healthcare industry. And super excited to be attending the sessions today and also for this particular session. And before I begin, just a background to the topic that we have. And the healthcare landscape is undergoing a significant transformation. And like all of us know, being driven by AI and genomics. And this powerful combination holds immense potential to revolutionize preventive healthcare, enabling early disease detection and personalized risk assessment. What I actually feel, and when I saw the topic, more than predicting disease, it's actually assessing the risk of various diseases. And that is what all of us have seen and learned in the entire diagnostics domain. And without much ado, I'll quickly start with my questions. And my first question is to Dr. Harsh Mahajan, sir. And sir, a recent study that was published in Nature found that AI algorithms could outperform radiologists literally in detecting breast cancers on mammograms. And a study in the Lancet also endorses that AI and radiologists working hand in hand work better than either of them. Obviously, with Vidur and Kapil and the great work that you've done, how do you see AI-powered tool impacting individual disease risk prediction?
Thank you very much, Arjun, and thank you to the organizers for having me here. Now, AI is coming in every facet of life, and in radiology, in the healthcare scenario, because radiology has been digital since 3 decades or more, it was but natural that it would be radiology which would be the initial focus. You talked about these publications in the Lancet. It may really surprise a few who are in the audience to know that the first paper in the Lancet on AI actually came from India. This was way back in 2018 from our group along with our collaborators, Cure.ai out of Mumbai. And this was on head CT scans. So the very first. So now coming to your specific question, there is no doubt that a radiologist, maybe not at the present point of time because the science is still evolving, but a radiologist with AI will definitely replace a radiologist who doesn't use AI. There are certain aspects of AI, and you alluded to X-ray mammograms. Also, we know for chest X-ray, there is a recent paper in which we were a part out of Mass General, Harvard Medical School, which showed that AI was able to pick up missed findings on chest X-rays from multiple. This was a multi-centric study. So one thing is definite, that use of AI for a radiologist will make an average radiologist good, will make a good radiologist better, and the better one excellent. And not only would it improve accuracy, it has also been shown that it will improve productivity. So today, if I'm able to report 25 or 30 MRI scans, going forward with the use of AI, it actually acting as an assistant to begin with, and maybe over time, being able to take away some of my workload, normal versus abnormal. I may be able to report 100 scans. The idea is that I should be able to report 500, something which happened in the field of pathology, where today a pathologist signs out 5,000 reports without worrying about accuracy, quality of the result. So that is where radiology is going. And I do feel that it is going to become a part and parcel, not only of radiology, also of histopathology, which is already beginning, and maybe also for the clinicians in decision making support systems, and ultimately maybe becoming better than the physician based on all the data that is available to make sense of that data and draw conclusions from it. Thank you.
So very relevant. I always look up to you when you speak, and you speak so well. But actually, just to put it in a nutshell, throughput and accuracy. And I think as long as we achieve both of those with AI. Recently, sir, I was in a restaurant where they had this thing that is a swok. That's basically a fork with rounded edges. So basically, it's something like that. It's like an assistant. It's like a doctor's nurse. But at the end of the day, it enhances patient care and gets the job done easily and even faster.
It actually will, we hope, it'll democratize healthcare, take it far and wide, take it to areas which are underserved, even in our country and in other parts of the world, and also at the same time be able to reduce costs, which is very, very important because affordability is a big issue in many parts of the world.
Especially in our country, sir. You're absolutely right. Thank you for that. So coming next to Mr. Shekhar Sibal, sir, and sir, recently I was blown away. I had the privilege of visiting Noora, and I think that is one of Fujifilm's investments in Gurgaon, apart from the few others in India. And I was completely blown away with the concept of going there and the kind of patient care, the hospitality, and obviously the kind of services that are being provided there. Recently, there was a survey by Accenture that found that 70% of healthcare executives believe AI has the potential to revolutionize preventive care. I think Noora is a great example, but still, I think in a country like ours, there are certain challenges that hinder the adoption of AI and genomics as well. So your thoughts on this, and please enlighten us about this topic.
Yeah, so as Dr. Harsh is sitting just next to us, he is a pioneer in this field, and thank you very much for calling me on this panel. And AI is definitely now going to be the most important thing for any of the screening things. As you know that we are doing in Neura, all the reports are through AI, whether it is calcium scoring, whether it is a breast examination or a mammography. So similarly, we are doing for the mass screening programs in India, what we are doing is that NTB program of Government of India, we are participating in a full way, and where our vans are going, taking X-rays, and there and then, with the help of Cure, our system is inbuilt with that DR, and it will tell you whether it is positive or a negative, whether it has a TB percentage, what percentage chances are there of having the TB, and then they will go for a gene expert test. So for the mass screening program, this is going to be a very, very big thing, and a country like India, because as Dr. Harsh will also agree with me, earlier there was nobody used to see those X-rays because X-ray reporting was very difficult actually. One of the most difficult. People are now able to do on CT, MRI, these are fancy things. But reporting X-ray was like people, young people were not happy reporting also. Many of the X-rays, chest X-rays go unreported also. As Dr. Saab has also said, there is a study in Mass Journal which they have told that there's a this thing. So basically, missed findings are there. So I feel that AI is going to revolutionize this field, and a lot of developments are happening, and mainly the early detection. Because in India, the major problem is there that we are getting a disease where, or the cancer is detected when it is a third or fourth stage. And in developed countries where these systematic screening programs are there, Japan, Europe, or US, there the cancers are detected very early stage and they are manageable. So a lot of cost savings will be there for the patient well-being will be there, early detection of the disease will be there. So this is going to revolutionize, but it is going to take some time because there are certain challenges of adoption. There has to be a good software, there has to be a lot of resources with the hospital, those teleradiology, or you can say that PACS systems and proper storing of the data. So all those things has to be a prerequisite as a basic thing. Because right now we do not have, many of our hospitals do not have the good quality PACS and a risk system. Unless you have that, and it will require more resources of the computers and computing platforms over that. So it will increase the cost initially, but when it comes to the masses, when you divide it into the number of patients, it will give you a lot of profitability. And as Dr. Saab has also said that one doctor can, earlier you can say that now in India there are 300 and 400 radiologists who do the breast imaging dedicatedly. But India requires 10,000 radiologists if we have to have a mass program. But it is not possible to develop 10,000 radiologists and doing only the practice of breast radiology. So AI is the only solution which can give you the faster, and one radiologist can do a job of 100 radiologists. So that's what AI is going to change.
Great, definitely. I completely agree. And I'll come back to maybe a few questions on the data that we collect from this and the patient privacy as well. But going next to Mr. Anand from Agilus. So this morning only, I read an article in the newspaper where it said how the preventive healthcare domain is giving wings to the industry, and there is a probable increase in the people going for preventive checks as well. I think the elephant in the room in our industry is that the industry is obviously getting commoditized to a certain extent. Keeping that in mind and keeping the increased awareness that people have, and also now the dawn of AI and genomics that obviously labs such as yours are going to are already doing, how do you think that AI and genomics will reshape preventive healthcare and empower individuals to manage their health more proactively?
Thank you, Arjun. Thank you, Arjun. Thank you for the question, and also thank you, Business World, for this opportunity. I think as we talked about both preventive testing, so preventive testing, if you see, it's about 20% of the overall pathology industry as of today, as of FY23, and we are seeing that it is growing at the rate of about 14 to 15% year on year, and this is probably the fastest growing segment of the industry. So when we talk about preventive testing and predictive testing, so there are two different categories of testing which happens. So largely what we see today in India is a preventive testing. Preventive testing is basically an tool of early detection. So whatever we do in preventive testing is not some new test. It's the same test that you're trying to use it in a healthy individual. So it's more about early detection of a disease. But when we talk about how we use AI and genomics, so there is an element of thing called predictive testing, which rather than just detecting a disease early, we are talking about a genetic predisposition to a particular disease. So when we think on those lines, we are quite far in terms of where we go as far as predictive testing is concerned. And that's where genomics plays a major role. Today, if you see, genomics in India is primarily used more in diagnostics and prognostic care rather than in the predictive genomics, even though there is a lot of interest and a lot of work is happening on that side, but still, there are a lot of apprehensions in terms of how we interpret those reports and how these can be used forward. A Mayo Clinic study recently, it showed that, 1 in 8 of people who tested for predictive genomics reported some predisposition. So which means there is something which can really help in improving the overall population health if we can do it in a much bigger way. When we talk about the future, how do we take this forward? One of the key factors in genomics, as you know, is the cost of testing. So as we know, why the sequencing is getting, more economical, we are able to have better sequencing and larger data sets with lesser cost. So this itself is going to help us in, bringing this to more general masses, as well as, how much of data we generate is going to help us with all the AI that we can do on the data to come to those kind of, creating those tables that will help us in analyzing the data in a better way. So I think these are the important factors as far as AI and genomics are concerned, especially in the predictive and preventive testing.
Thank you, sir. I think all of us have experienced the previous decade where, like you said, genomics was more in oncology, and that's where it really started. But I also feel that the predictive part of genomics, people understanding, more importantly, physicians understanding what predisposition is, what are the measures are there to be taken. I think the famous Angelina Jolie story with the BRCA positive created a lot of awareness, but I think the country still needs certain leaps, needs to grow by leaps and bounds in that direction. So, Harsh sir, my next question is to you. And so again, referring to a report by McKinsey, showed that the potential of combining genomics and AI for preventive healthcare. Obviously, you have again been a pioneer in that integrated medicine and integrated centers and diagnostics that Mahajan Imaging has. But with genomics and imaging rapidly evolving, how can their integration benefit preventive healthcare? Also, sir, I see that a lot of AI companies, startups now are looking at globally to expand their footprint and doing business development prospects abroad. And I wonder, in a country like India, where, like you said, last mile delivery is a challenge, there's so much population, so many doctors, why is India not a hotspot for this? Is it the affordability, or is it the accessibility, or the acceptance?
These are both great questions. And let me take the second one first. I think in India, affordability is the major problem. When we talk of a population of 1.4 billion, 40% of them are able to afford very little. Even 2 square meals a day is a challenge. And so you have only a top maybe 1 or 2% where you could think of them being able to afford almost everything. That's point number one. Point number two, somehow technology or learnings or teachings which come from the West are much more readily accepted in our country. Maybe we are still trying to get out of the hangover of our colonial masters, and I'm sure the younger generation would be out of that very quickly. Third, also the infrastructure for taking all this to tier 2, tier 3 is really impossible when we are still struggling at the primary healthcare level in most of our districts to think that genomics could somehow be taken up at, or AI could be taken up at the peripheral level very immediately is very difficult. And that's why somehow the startups are building in India, but building for the world. And maybe at some point of time, the technology would translate down 2, 3, 4, 5 years down the line. Coming to your first questions, and many of these youngsters are doing very well. Coming to your first question, which was how genomics and imaging can play a role together. And we did build 2 years ago a center of integrated diagnostics in this city, where we have tried to integrate a path lab with all the blood tests, with imaging, along with genomics, nuclear medicine. So the entire, armamentarium that is available in diagnostics under one roof. And how is it going to be useful? Genomics, especially when we talk at a population level, or even if we come down to those at high risk for genetic diseases, especially cancers, also maybe, dementias, Alzheimer's, heart disease, renal disease. We know that a large part of these diseases can be genetic. And so just envisage a scenario where out of the 1.4 billion population, suppose a genome testing was 100 rupees or 500 rupees, and the government decided that we are going to run a genomics test looking for those at high risk across the entire population. And out of those 1.4 billion, you're able to pick up 50 million people who are at high risk for cancer. Then you have divided your population into 2 categories. One at average risk for cancer and the others at high risk for cancer. And once you've picked up these high-risk people, you subject them to whatever be the best test for picking up cancer early. Mammography in women, maybe even ultrasound of the abdomen, low-dose CT for lung cancer. So your resources could be much better spent. And as Shekhar said, we could pick up cancer early in stage 1, stage 2, maybe even at a very, very early nascent stage where they can be cured. Today, we are picking them up at stage 3, stage 4, where the cure is really in terms of 5-year survival, 10-year survival, and also the morbidity, the costs. So, you know, in preventive healthcare, predictive medicine through genomics could play a major, major role, and tied to that, screening, which is done very religiously in those at high risk. I'm not saying that we don't screen those at average risk, because sporadic cancers are the majority of cancers, but those that are at high risk, we can certainly screen them much more diligently, and actually the healthcare system would end up spending lesser if we were to be able to pick these up. Having said that, is genomics the only way to pick up those at high risk? No. There are so many factors: family history of cancer, family history of heart disease, family history of dementia. All of these can also be used to pick up those at high risk, till such time that genome testing becomes so readily available and affordable that anyone could, you know, come into one of our labs and say, "Doc, I want to get this done, and if I'm at high risk, tell me what are the tests to be done." But the future certainly is about integrated diagnostics. We cannot continue to work in silos, and a health check cannot just be testing for blood and that's it, you've done it. Also, you know, when we talk in terms of health checks, somehow the way it has been till now, these were always done within hospitals and done at very, very low rates, done on equipments which may not be the best, done by juniors who may not be the best. I think for health checks, you need the best equipment, you need the best people to read those scans. Maybe AI in the years to come will play a role in it, but it should not be dismissed as it is as a silver test. We got silver, you know, health check done for our low-level staff, and you know, golden one for the higher level, medium level managers, and a platinum one for those at the top. I think what genomics, risk assessment will also bring in the concept of personalized health checks, doing what is right for the person based on family history, past history of illness, present history of illness, so that the correct testing is done and not everyone being whitewashed with the same brush. Thank you.
Absolutely, sir. I completely agree. One size doesn't fit all, and I think it's tailor-making these tests to best get the output of these tests. And so, sir, my next question is to you, Shekhar, sir. And it is often predicted that AI-powered imaging will play a very crucial role, like Mahajan sir has also said. And for example, AI could analyze retinal scans to identify individuals at risk for diabetic retinopathy before symptoms even appear. And what specific advancements do you feel like we already know what is happening in the AI-driven medical imaging world right now? But in the years to come, what do you anticipate is really going to be, what are the disease areas that are going to be worked upon, and what can we expect even from Fujifilm, that's a leader in the space, for the years to come?
Yeah, so we are working and putting a lot of money on developing the AI applications, and we are putting generative AIs and many kind of techniques, And all the modalities now, if you take CT scanner or MRI or you take a mammography, in MRI especially what we are doing is to reduce the scan time, because the most important thing is the patient inside the gantry. The time has to reduce and the openness has to improve. So that time, you can do more patients if you have more time. So in MR, what we are trying to do is to have the better image quality in a lesser time. Each sequences, we are trying to reduce those times. Similarly, CT, we are having many protocols for stroke protocols, etc. When a patient comes and if he has been given a faster treatment, then life can be saved. Similarly, on the chest X-rays, for in the ICUs, when you have a mobile X-ray, there if you have certain softwares, you can immediately tell and the doctor can be alerted from mobile X-ray itself that this person has a more problem and you have to attend to this person. So in each and every modality, in mammography, in chest X-rays, for early detection, for the screening, so a lot of work is being done, and now we also feel that machines, the doctors will take those machines only which are AI-enabled machines. Otherwise, there will be no distinction. Suppose I have a mammography machines, GE has, Siemens have, Philips have, but which machine they will be preferring? They will be preferring a machine which can give a faster diagnosis, which is able to give them more patients at a better image quality. So those machines will be preferred. So now we are trying to put all those softwares into the machines and bundle that and try to sell it to the doctors. So this is what our endeavor is, whether it is in the screening for mammography, whether it is the MRI, whether it is CT, X-rays. So AI is going to become an integral part of our machines.
Thank you, sir. That's very interesting and looking forward to those advancements. So, Anand sir, my next question is to you. And I think in a country like ours, the government plays a very important role in realizing this potential and with this topic of AI and ML in healthcare. However, there are challenges like infrastructure limitations, fragmented data ecosystems that obviously persist. What specific measures do you believe that the government could take to act as a driving force for AI and ML adoption in India's healthcare framework? And given India's diverse demographics and cultural landscape, what could the government really do to push in this direction?
Yeah, thank you, Arjun. So I think this is also a very important aspect that we have to consider if we are talking about the growth of the genomics and AI and the role of AI going forward. So one of the key factors here is that AI is all about data. So as long as you are not able to have a data in a structured form, you will not be able to analyze the data and do something about it. So that is where the major problem for India is. Even though we have such a huge population which is quite diverse, and with each states having their own requirements in terms of disease burden, the spread of diseases, whether it is communicable, non-communicable, lifestyle diseases, new age diseases. So all these have a pattern across the country, which is quite different from what we find in Western countries, where there is some data that is available through which you can apply and work on these predisposition related things. So when we talk about how do we actually get this data, how do we get the structured data, it's about all the institutions coming together in healthcare. So whether it is a laboratory or whether it's an integrated diagnostic center or whether it is a government-related organization or any healthcare service provider or a hospital. So how do we integrate this data? I think one of the first steps by the government in this is talking about the Ayushman Bharat health account or the ABA ID, which probably on the long run is what is expected is that it will create an interoperability between the various setups, and we will talk about how we can bring about that data which is there for the patient from across different ecosystems within the service providers. So how do we bring this data and how do we actually use that? So in labs like ours in Agilus Diagnostics, what we do is, we provide patients with trend reports. That is the longitudinal reports of their own reports over a period of time. But what we really need when we talk about population health is how do we get overall data for the particular community or for that particular area, for that region. If we can actually get that kind of data, so that will help us in actually providing clear, actionable insights for the doctors, for the clinicians to treat the patients. And that's how even our predictability testing and the preventive genomics scenario also will improve with specific reference to India. So that's where I think the government also needs to focus and work on.
Completely agree, sir. I think this data is integral for actually guiding the government also where to actually put in the money on what are the disease areas and where exactly to focus on a larger perspective of the population. Sir, do you have a point? Please.
Yeah, just to say that the government of India has been pretty proactive with them having brought in the ABDM, which is the Digital Health Mission. And here, what the government has envisaged is that all data, healthcare data, would be in digital form, and the government will actually build the skeleton. And both the public and the private sector of healthcare has to actually provide the flesh, so that right from every visit that a patient has to any doctor, even a small clinic, that's envisaged. How long it's going to take, or what are the obstacles in reaching there is a separate matter, but the government does have the vision. And of course, it'll take a lot of doing, it'll take a lot of money, it'll take a lot of change in our thought processes. But if that were to happen, then at the click of a button, you could see heat maps and know TB is more prevalent in this part of the country, and more boys are being born here, more girls being born there. So, and also that data could be used for developing algorithms which we could use for ourselves, both for diagnosis as well as for treatment, because ultimately India will have to find solutions to its problems within. Of course, we can learn from other parts of the world, but we have to find our own solutions. So going forward, it may take 5 years, 7 years, whatever, but the intent is there from the government.
So completely agree. Also intent, and I think they've also incentivized the stakeholders for this, like for the ABHA ID. I was on a call yesterday where they were saying that every ABHA ID generated by a lab will give them like a 10-20 rupees incentive, and also to the LIS vendor. So I think that's a great way at the end of the day to push this agenda. And obviously they are doing great work in this. And with this, I would like to thank everyone. We still have a few minutes left, although quite unusual in a panel discussion. But I think it's God's plan. If someone has some questions or any comments from my fellow panelists, I would love to have them. There's a question. Can anyone pass a mic?
Good afternoon to everyone here. Myself, Sanuj. I would like to ask a question and would love if any of the panelists would answer it. So, if I'm correct, there was a mention that the third most leading cause of deaths in our country is our preventable diseases. So, I was thinking that what all could be done regarding that, and if awareness campaigns could be created and in which the government can be involved and the role models can be invited, the brand ambassadors and everything can be done. And then with that, funding can also be created for certain sectors. As we saw in the polio eradication vaccine, Bachchan sir was very actively involved. So I would like your opinions or any other stuff which you would like to comment on.
So that statistic is from the US, where the third largest cause of death in a hospital is preventable mistakes that occur. In our country, we don't have any data. But to answer your question, definitely awareness needs to be increased. There has to be. There was a whole session on quality and looking at providing quality, minimizing errors, being aware of the fact that these occur, and being able to reduce them. And Kaho and Dr. Vijay Agarwal, who spoke, they are taking a lead in doing this. We need to sensitize actually the medical fraternity about it, and also you very rightly said, patients themselves, so that they also ask questions as to why a certain treatment has been authorized or a certain test is being done. It'll be a slow process, but in the West, in the US, where everyone is so aware and educated, and their healthcare system is supposed to be number one in the world, that is where this is the third leading cause of death. So it is a very, very serious issue and needs to be addressed in our country as well.
Thank you so much, sir. Thank you.
Thanks. So another point on the preventive part to your question, and the one who should not be named regarding the cervical cancer campaign that just happened. But otherwise, again, that is also an example of how people are really putting their minds together, not only to spread awareness, but even with a little simple thing as a pap smear. There is a lot happening from the government side. Also, AI now in histopathology and cytology, having reached a certain level, I think great work is being done in the preventive space from that aspect too. Great. Any other questions? Please. There should be a classification of the labs.
Star class.
Well, your wish is granted, sir. There's already work which has been done where, a star classification based on not only diagnostics but hospitals. I think it's equally important for hospitals. That whole document has been prepared, and it took nearly 6 to 8 months to do it. And based on that, there are prerequisites that each star rating, in a sense, I don't know what exact terminology it's going to be, whether it'll be called star rating or something else, but that work is on in real earnest, and very soon it would be there.
This diagnostic centers, they have a major role. All high qualified doctors, they are depending on the pathologist, whatever report they prepare. So the modernization of the upgradation of the lab, that is very important. Qualified pathologist is very important. Experienced pathologist is very important. Accreditation is very important. Certification is very important. Once you get the certification, after 3, you have to wait for 3 years. In between, no checkup of SOPs or the quality checkup or mushrooming the pathologist, not the pathologist, the lab, mushrooming in the state.
There's a lot of focus on that, sir. Labs being run by quacks. NABL accredited labs are very few in number, considering the total number of labs in the country. We don't even have data on how many labs are there in the country. So each and every point you make is very, very valid. And there is focus that is being put on these aspects. And hopefully, in the months and years to come, we'll see a change.
Last but not the least, the last question. This AI equipment, Mr. Chander, you rightly said, it's a very high cost equipment, AI, the new equipment with the AI. What about the existing equipment? How to dispose of this existing equipment? Is there any buyback, or the government will give any subsidy on that if you are modernization or upgradation of the latest equipment or existing equipment?
The government gives no subsidy to healthcare. We pay commercial rates for everything, whether it's land, whether it's loans, whether it's power, whether it's water. So to private healthcare, there is zero incentive or zero concession that the government gives. Point number one. Point number two, regarding the equipments that are already there, there are ways in which these equipments on payment of certain sums of money can be upgraded using AI. But don't think that AI is going to be the panacea for all the problems that we have. AI is slow in coming. It is coming into medical equipment and being able to fasten or hasten the scan times. It is able to lower radiation doses that are given on a CT scan or on an X-ray. And there are also commercially available algorithms which can be used externally to improve quality using AI. So, but this is a slow process, and I can tell you, India is not lagging behind our Western counterparts as far as availability and use is concerned at the present point of time and going forward.
When this industry will be given as an industrial status?
We've been struggling, sir, for many years. You put your weight behind us that the healthcare industry is given industry status.
Great. So great questions. Just to add about the accreditation part. So we completely agree there are mushrooming of labs everywhere, sir. But when we speak about NABL accreditation, I don't think many people would know that an NABL accreditation, just as your tagline in the lab, doesn't mean that all your labs are accredited. So some labs, what they actually do is that they'll have that NABL tagline in their advertising, but actually when you look at their test menu, it'll just be like a handful of tests or a small percentage of tests that are NABL accredited. Apart from this, on an ongoing measure, sir, we do external quality assurance, we do internal lab comparisons, there are peer comparisons. So quality is more than a culture, is actually a culture and an ongoing process, just then accreditation. And apart from the second thing, like sir said, we don't get much subsidy from the government, but I think we get incentivized, and obviously we are blessed to have been given the opportunity to be here on this panel discussing this with all of you. A big round of applause for Business World and all my fellow panelists, and humbled and privileged. Thank you once again.